Hello and welcome to Wake Forest Men's Health. So today we're going to be talking about erectile dysfunction in men. Our anatomy is very similar, okay? All babies start out the same for about the first 7 to 7.5 weeks of life. So if you think about the female scenario, we have 2 gonads in the pelvis, what become the ovaries, clitoris, erectile chambers leading up to the clitoris, urethra to empty the bladder, vagina for sexual activity and for birthing children, and 2 skin folds that protect that area. So what happens at a certain point as the baby is forming, for the male children, we see a migration of structures. And what this results in, so you have what was the clitoris, now larger and extended. What were those chambers that just led to the clitoris down low have now extended forward. The urinary tube is rolled into the center here. That's called the urethra. Okay. The gonads, now called the testicles, have migrated down through 2 rings in the abdominal wall. And the vagina has closed and the skin folds have fused such that if you look at the scrotum, you can see a seam down the front. So we're all beautifully and wonderfully made, okay? And so the blood that runs down these chambers, so unlike what my 2 young sons think, there's no bone in the human penis, okay? So the blood that runs down these chambers creates the rigidity to allow for function. So if you looked at a cross-section of this area, essentially 2 chambers that fill with blood, that's on top, we'll call this the top side, we'll say maybe this is 6 o'clock, and the urinary tube at the bottom to empty the bladder. There's just a single blood vessel running down the center of these chambers, surrounded by spongy tissue. So it's not uncommon to see changes here because of the small nature of that blood vessel. If you think about the changes that are happening in our whole body, which is why heart disease is the most common cause of death for men and women worldwide. So, man says, Dr. Terlecki, the medications just aren't cutting it anymore. What do you have for me? Well, the way I like to group it, to keep it simple, is we have 3 basic categories of options. And what I'll do is I'll describe those as the option, the middle of the road option, and then full restoration of function. So let's go explain what each one of those means. Let's see, I'll use a black marker to make it a little bit easier to see. And again, this is just my terminology. You can call these whatever you'd like, but I'm going to explain what each one represents. The first one is probably the most simplistic, okay? You want blood in this tissue to give you some pressure for sexual function. So, there's something called a vacuum erection device. Looks like a clear plastic tube, similar to what you set your checkup at the bank with, okay? And the more modern versions are battery powered, so you just press a button. The older ones, you had to use a hand crank, so some people refer to this as a pump. It's going to pull blood into this tissue manually, but you can't engage in intercourse with this tube on your anatomy, so this has to be supplemented with a tight band that rolls off that tube onto the base of the penis so the tube can go away. That can be a little uncomfortable. Technically, you're only supposed to leave it there 20 minutes or less, although some people kind of push that beyond those limits. But it can also create the perception of a lack of spontaneity. It seems cumbersome. It's like a mini suitcase full of parts. And some people will say, well, what if I want to clean this in the dishwasher and someone comes over? I've heard all kinds of stories, but needless to say, very few men stick with this long term, okay? So that's the option, if you will. The middle of the road option, instead of taking drugs by mouth that have to be dissolved in your stomach, absorbed into your bloodstream, travel all over your body and can cause the side effects that you may have experienced, headache, sinus congestion, facial flushing. Now you can just deliver those drugs directly to the area you need it most, but that involves using a needle to do so. A lot of guys are a little hesitant about the concept of a needle in a sensitive part of their anatomy, namely the penis, and I get that. Some men tolerate it just fine, okay? So what that involves is you would prepare the skin with an alcohol swab and inject medication directly into one of these chambers. You might want to encourage activity a little bit, with some massage and things of that sort, but typically within minutes, if it's going to work, it will create the blood flow necessary for sexual activity. Does it work in everybody? No. Does it ever work too well? Where you have one of those prolonged erections you hear about on the commercials and you have to go to an emergency room to get treated? It can, but that's why you always go up slowly on the dose. Is it really painful to inject? For a lot of guys, they're able to tolerate it just fine. It may have some slight burning after the fact, but they tend to tolerate it fairly well. Psychologically, it can be a little bit of a challenge, and it can kind of be disruptive to intimacy. So if you say to your partner, hey, I see where this evening is going, hold on a second. Let me go to the fridge or freezer, get my vial of medication, warm it up, drop the liquid into a syringe, put that vial back, go to the bathroom or bedroom, prep my own skin, get over my hesitation and inject, head back to the bedroom if it's worked, or maybe your partner's turned over and gone to sleep. Or maybe it hasn't worked, and now you're frustrated and your partner's frustrated because of unmet expectations. So as you can see, it's kind of a mixed bag, right? If it works great and people love it, great. Is it covered by insurance in most cases? Not in most cases, okay? It's reasonably priced, but tends to be a little bit more than oral medications, especially since those have gone generic. So that's why I would refer to this as a middle-of-the-road option. Full restoration of function simply involves putting a liner into each of these chambers that's custom sized to the given individual. So what we typically do is in a single outpatient procedure, often covered by insurance, we can enter the skin here, okay? And that procedure typically takes us less than an hour. We can access these chambers, determine their length on stretch, and then place a custom-sized chamber inside there. Close everything up, and it's part of an internal system that cycles what is now body temperature fluid, just like the blood was, into those chambers to create an erection. And through use of a one-way valve, it keeps the fluid in there for as long as a man desires. So now he can have an erection on demand that'll get as rigid as he wants it to get and stay up for as long as he wants and then go away when he wants. So there's that comfort of knowing what to expect and not having to worry about either unmet expectations or problems that would take him back to a medical center. Okay? So people often ask, well, what's the downside? Well, one of the downsides is we can't do this for everyone. If someone's a poorly controlled diabetic, we require that they get their sugar under better control first. We also like them to be able to be cleared to hold blood-thinning medications for several days before surgery. So if someone just recently had a cardiac stent placed, we want their doctor to give them the okay before we proceed. But in general, if someone's healthy enough for sexual activity and healthy enough for a minor outpatient procedure, this might be a great option for them. So I would describe these as the 3 classifications for options, as I see them, for the man who has failed oral medications for his sexual health.